Alright, hi, my name is Kristen Collins. Today I'm going to be demonstrating insertion of an NG tube as well as irrigation. Before beginning, I would check for physician's orders of the NG tube and the purpose of the NG tube. Today the physician would like a suction NG tube placed for decompression of the patient's stomach. Before beginning, I would have make sure coming into the patient's room that the bed is in a high Fowler's position and it's up to my waist level for easy working with the patient. So now I'm going to go into the patient's room.
Hello.
Hi, I'm Kristen Collins. I'm going to be your nurse today. Your physician has ordered us to place an NG tube to help get some of those gastric secretions out of your stomach. Can you tell me your name?
Mitchell Wilson.
All right, Mr. Wilson, what's your date of birth?
7/27/54.
Okay, Mr. Wilson. I would verify that against his wristband, just for safety precautions. And Mr. Wilson, your doctor has ordered the NG tube. Do you know what that is?
I think so. He tried to explain it to me.
Okay, well, we're just going to place a tube through your nose into your stomach and help get some of those secretions out of there that might be causing you some nausea and some pain in your abdomen. Is that okay?
That's good.
All right. So before beginning, I'm going to assess the patient's oral cavity and the patient's nares to make sure they are open. Okay, they are clear. Mr. Wilson, I'm going to have you hold one of your nostrils and breathe through it. Can you go ahead and do that? Okay, your other nostril? Okay, so now I am going to measure the length of the NG tube, which is going to be using the NEX method. From the tip of the nose, around the ear, the xiphoid process, the lower, or the left upper quadrant. Okay, so I have measured the NG tube. Now I'm going to apply my clean gloves, do some hand hygiene. Alright, and I would lubricate 4 inches of the NG tube for easy placement. And I would let Mr. Wilson know that the procedure is about to begin. And also, I need to put the towel on him first. Okay. All right, Mr. Wilson, I am going to begin advancing the NG tube. Will you please make sure your head is against the pillow and look up a little bit for me? Okay. So I will check the back of the oral cavity for any coiling. Okay. I don't see any coiling, so I will continue advancing with Mr. Wilson placing his chin to his chest and having a sip of water and swallow, swallow, swallow. All right, so I am going to temporarily tape the tube to his cheek so I can verify placement. All right, so Mr. Wilson, can you speak for me?
Yes.
Okay, now I am going to aspirate for 30 milliliters of gastric secretions. Okay. Then I'm going to listen to the secretions back into the stomach to make sure they are going back. I'm listening in the left upper quadrant. Alright, so I hear secretions going back into the stomach. For further verification, I would send, with the physician's order, Mr. Wilson over to X-ray to verify his placement. So Mr. Wilson has come back from X-ray. They have verified his placement. So now I'm going to attach the nasogastric tube to the end of his, or to his gown. Oh, before I attach it, I need to actually tape the nasogastric tube in place since verification of placement was confirmed. Oh my gosh, these gloves. I can't get with big gloves. Alright, so now I'm going to place the rubber band. And this just allows Mr. Wilson to be able to move his head without pulling the NG tube out. Now I'm going to attach the nasogastric tube to the suction source. And then I'm going to document what we did with Mr. Wilson today. We inserted an NG tube. I would state the NG tube's length, the purpose for suction, the secretions that we're seeing, also the client's response, and any instructions that were given to the patient, and the date and the time and the nurse's initial. And that would be just your normal NG tube insertion for suction. So now I'm going to go back into the patient's room because he is experiencing some nausea and abdominal pain, and we need to irrigate. So I'm going to implement standard protocol by positioning the client into a semi-Fowler's position.
Yes?
Hi, Mr. Wilson. I'm Kristen. I'm back to irrigate your nasogastric tube to help relieve some of that nausea.
Yeah, I'm not feeling well.
Can you state your name?
Mitchell Wilson.
Okay, and your date of birth?
7/27/54.
Okay, so I have verified Mr. Wilson's date of birth and name against his wristband for safety precautions. Now I'm going to place the bed in a semi-Fowler's position. Okay, and I'm going to disconnect the nasogastric tube from suction. Let me put his towel on first. I'm going to apply clean gloves. And I got to check for placement of the NG tube, so I am going to aspirate 30 milliliters of gastric secretions once again. And also, if your hospital does require it and it's part of the policy, we would place the gastric secretions on the litmus paper just to verify the pH. Alright, so I have pulled 30 milliliters of secretions. Now I'm going to listen for placement. Okay, so I have verified placement. I did hear the contents go back into the stomach. Now I'm going to insert 30 milliliters of normal saline into the stomach. so now I'm also going to withdraw the 30 milliliters of normal saline that I've inserted into the stomach. Okay, and now I'm going to discard. Okay, so then now I can go ahead and place the patient's suctioning nasogastric tube back to the suctioning device. And now I'm going to state the documentation for irrigation, which would be the type and amount of the irrigation solution, the contents that we pulled out, along with the amount of any extra gastric secretions that may have come out with it, the client's response, the time, the date, the time, the date, and the nurse's initials, and any instructions given to the client I would also document. Then I would also, before leaving, I would make sure the patient's bed is in a semi-Fowler's position, place it back to a regular level for the patient, make sure the patient's belongings are nearby, the patient doesn't need to use the restroom, just assess his pain level, and then make sure I have the call bell nearby in case he needs me. And that would conclude the insertion and irrigation of the nasogastric tube.